active servo ventilation, these are all advanced. Then is lifestyle modification. Man is already tired. No problem, ma'am. I totally understand. You know, so lifestyle modification is not easy, right? It is not easy to ask people to lose weight. I know it because I've lost. You know, you can tell it's very easy to say, you know, you need to lose weight, all of that. This is how I looked last year in Feb. You can see, this is not to show my weight loss, this thing. This is basically to show you how my neck, look at that fat around my neck. Okay, and you can see my neck now. That's the difference, right? So it is not easy for people to lose weight, even by just telling people, because if you're not sleeping right, it is very difficult for you to have that willpower to take. And trust me, losing weight is not about hitting the gym and all that. It's all in the diet. Okay, so but you will not have that willpower to eat responsibly if you're not sleeping properly, because most of the time you're mindless and you'll stress eat and additional stressors and you'll keep eating. So it is necessary, if you do some kind of, you know, either you'll have to start these patients on with the CPAP or an oral appliance, and then some, along with that, you know, that once they're able to sleep a little better, they'll also be able to focus on this better. For those of you who want to know how I lost weight, it is, I did intermittent fasting. And just a tip, if you're doing intermittent fasting, it is a lifestyle. If you think after some time, after I lose weight, I'll go back to normal, this thing, all of this is going to shoot up back and in ultimate level. So these are all free tips. So, you know, because I think this is a very hot trend, and personally, you know, I tried being active on social media, but it's not for me. But I see social media, my wife is very active, you know, she does this quoting, a lot of things on this weight loss, and you know, you have a lot of supplements and all of that. For those of you who want to try supplements, trust me, they don't do anything. They just fill you up. Okay, and I know there are supplements like Herbalife and this and that, so trust me, they don't, it's just about, you have water. Okay, you don't need any supplements. Supplements will only fill your stomach, so. Positional therapy, like what I said, for mild cases, even positional therapy can work, sleeping to the side. Okay, I've already explained that. And oral appliances. Now, oral appliances, there are different types of oral appliances. Now, all these oral appliances, either, most commonly it's two types. Palatal lift, there's something that lifts the soft palate, it's not very common. One is a tongue retaining device that retains the tongue in the forward position, or it's a mandibular advancement or adjustment device. I'm focusing on MADs. These mandibular advancement devices can be two types. Custom made, over the counter. Over the counter is not going to fit kind of well, so you're not going to get that kind of a result. And you have another two types. One is which can be adjusted or titrated, and one it is fixed. Definitely you can also make an acrylic appliance just by bringing the mandible, taking a bite in the forward position, right? But why doesn't it work all the time is you don't know which is that correct position where this is going to work. So if you have a titratable appliance, you can adjust that appliance and the mandible goes incrementally forward. So you get better control over this therapy. Okay. So what are the advantages? Definitely more easy, more comfortable, more easy to carry around. You can carry it around anywhere. I have mine with me all the time. And you know, it's more acceptable to the patient and to people who are sleeping with us also. So, but definitely oral appliances also have some, you know, require some monitoring. The other one is a machine which is just pushing air inside. So this is attached to a teeth, right? So as dentists, we need to monitor the patient. Okay? That is very important aspect. And definitely long-term use will have some kind of small side effects that are there. Minor changes in occlusion that can happen over a really long period of time. So all of these things can only happen if they're used for a really long period. But that's why monitoring is important. Okay. So by the way, when coming to, and when I say this or when I speak, what are the disadvantages? TMJ problem will come, occlusion will change, and when I think is, I've been 6 years over here, and I've kind of seen what is the kind of focus on occlusion. To be very honest, the focus on occlusion is very less. Most of I know the clinicians want an under occlusion. Why? Because it's easier to give the crown and the patient doesn't feel the crown and it's super. Everything is normal, right? So see, that is a problem with the system basically. So it's going to be a very minor change in occlusion, but definitely we need to monitor these patients whom we are giving oral appliance therapy. It's very important. I'm saying this because some patients they come. Now most of the cases that we've done with Dreamvent, there are Indian patients, a lot of patients from outside, NRIs who come for a vacation. So I tell the doctor, patient is flying tomorrow, don't give this box to them and send them off. Then you need to monitor the patient. Okay, either you have to do some kind of a video conferencing thing. So monitoring is important. So as per the American Academy of Dental Sleep Medicine, you can monitor these patients by their symptoms also. That is one way to do it, and how they are sleeping. Or you can do a multi-method positioning, is that you can do a polysomnography or a home sleep test in between the titration or after the titration, just to see how effective it has been. Okay, so there are two means that you can do this. So this is a tongue retaining device that keeps the tongue forward. You have a palatal lift device and different types of mandibular repositioning appliances. So we are coming to 27. We have more than enough time. A little conscious about the time because. So coming to this. So this is a novel therapy. Now why is this a novel therapy? Because this is the only appliance of its kind in the world. This has not been developed by Dencare. Dencare, we have just collaborated this with a company in Canada to bring this to India. We've registered the product in India and we've brought this to India. So I told you I've been suffering, so I've tried different oral appliance therapies also. And how many of you have heard of that Dencare has another appliance for snoring? No, it's called the Silencer SL. It's called the Dencare. Yeah, it's all different names. So Silencer is the actual name of the product, and Silent Night is what Glidewell in the US markets it says. Different people market it in different ways, but it's an amazing appliance. However, it didn't work for me. Why? Because I also had a nasal obstruction. So that's what I'm going to be speaking about, and why this is different. So I actually went a little deeper into this and found out if there is something that can address this obstruction. One, you can ask me, I can get surgery done. Definitely I could have got surgery done, but I've interacted with people who have got surgery done, and unfortunately those people didn't have that good of an experience. So these people whom I know, but definitely there are people who have had good experiences, but I couldn't get myself to go and get surgery for this. So that's how I found out that there's an appliance that helps to bypass this nasal obstruction. So that is why this device is unique. And the other things I will tell you. So if the patient has normal snoring, okay, in case the patient has, how will you know if it's normal snoring? It's only if you do a sleep study if you know. But generally, if the patient has snoring and all of that, you can either give an advancement appliance or along with behavior management. So if the patient has mild to moderate OSA, the first this thing is to go for a mandibular advancement appliance. And if the patient has